Hello, my name is Dr. Gretchen and I am a pelvic floor physical therapist with Breakfreept Pelvic Health and Wellness, and I'm going to talk to you about the pelvic floor and its effect on low back pain. And there was a really interesting study done where they looked at non-pregnant women and the effect of the pelvic floor on low back pain. And what they found was that 95% of non-pregnant women that have low back pain have some degree of pelvic floor dysfunction, which is a extremely high number and a big thing that we may be missing whenever we get treatment for low back pain and we're not addressing what's happening within the pelvis. So the pelvic floor are muscles at the bottom of the pelvis, and their job is to control bowel, bladder, and sexual function, and they also support our reproductive organs. So what they found in the women that had low back pain, most of them had some pelvic floor tension. So that just means tightness of these pelvic floor muscles. And usually if you have pelvic floor tension, sometimes you can have other symptoms of constipation, painful intercourse, hip pain, tailbone pain or history of a tailbone injury, or difficulty emptying your bladder, or sometimes urinary urgency or even urinary incontinence can come from tension of the pelvic floor muscles. They also found about 40% of women had some degree of pelvic floor weakness, and that's where these muscles are weak, so there may be compensations elsewhere in the body within the hip or the spine or the low back due to weakness in these muscles. And with that, you may also have urinary incontinence or even sometimes fecal incontinence or symptoms of heaviness and pressure, which takes us into the next group of women they found that had low back pain with pelvic floor dysfunction was having pelvic organ prolapse. And so when that happens, either the bladder most commonly or the rectum actually protrudes into the vaginal canal, and that is due to a laxity or weakness within the vaginal wall that occurs that causes that to happen. The uterus could also prolapse down, but most commonly it is the bladder, and we can actually improve that with pelvic floor physical therapy, and that is strengthening or reinforcing those pelvic floor muscles to support those pelvic organs. And so due to the connection of the pelvic floor back to the tailbone and the sacrum back here, which is this guy here, that can cause a lot of stress onto the spine. And so that is how the spine and the sacrum and the pelvis need to work together to have a good functioning optimal pelvic floor.